You heard me talk a few minutes ago about abortion in this country. Well, the single most valuable tool that we at ZoeCare use when a pregnancy patient comes in wanting an abortion or considering an abortion is our ultrasound machine. Statistically speaking, 86% of women who see an ultrasound image of their child choose life. 86%. So having a good ultrasound machine is pretty important. Unfortunately, over the last several years, ours has gotten a little worse for wear. The image quality's gone down. Our probes have been less than brand new, I should say. But then along came some generous, mission-minded folks who took it upon themselves to fix our ultrasound problem this last year. Because of the abundant generosity of Michael and Young-Suk Garrity and the Gianforte Family Foundation, this past summer we had a new ultrasound machine delivered to our office. Its images and video, which you will see in a few minutes, are far surpass anything that we have ever had, ever. Allow me really quickly to share a dedication letter from Michael and Young-Suk for this amazing gift. This is from them. Our gift is made in loving memory of Michael's birth mom, who in 1944 chose birth rather than abortion. She loved Michael enough to be involved in making an adoption plan during a very difficult time in her life. Isn't that amazing? Now, because Michael's birth mom chose life instead of abortion, chose the loving route of adoption rather than terminating her pregnancy, which, despite Roe versus Wade, you could do in 1944. Because of that, women today now can choose to keep their unborn babies because they will see the image of their child up on our brand new ultrasound machine. I mean, that's just great. I mean, I think it's great. It just, who would have known that, 1944, all these years later, that women would keep their children because of this one act that this mother did. I just love that. So now to talk more about this new machine, and ZoeCare's Patient Services is our patient services team, headed up by our nurse manager, Lisa Doerksen, which I believe they're coming.
Good evening. It's my pleasure to introduce to you our patient services team, some of which are standing up here and some of which are seated in the audience with you all. The initial contact that a patient who comes to Zoe most often sees first, the first contact, is Deanne Fisher, who is our receptionist sitting right over there. And this is very important because Deanne sets the tone through her gentleness and understanding way that Zoe is a safe place to share her story. Emily Marks and I, Emily here, raise your hand, are the nurses, and we assess patients, provide appropriate testing and education, and we also perform limited OB ultrasounds. Our aim is to implement best medical practices and deliver our care with compassion. We work in tandem when we work with the pregnancy patients with a patient advocate, and we have several here sitting out tonight, Deb Hall and Barbara and Cindy, and then our head advocate is Sarah, right there. And the advocates provide emotional and spiritual support during the visit. We also have Mike Wheeler, who you're going to hear from shortly, and he is around as well as the male counterpart advocate to the partner of the pregnant patient when he comes in as well. At ZoeCare, we have the great fortune also to have two excellent physicians who volunteer their time and expertise with us, and we really are blessed in this. Dr. Wendy Handley is a certified physician in internal medicine, and she supervises our STI/STD program at ZoeCare. She volunteers to see patients every single Monday afternoon and has done this for over 4 years now, I think. And we really appreciate that. She's fostering a relationship with the Bozeman Health Services lab service, and they provide our testing for our patients without charging us or our patients, and we feel very blessed in that as well. She seeks to build a trusting relationship with the patients and finds that this often can lead to more opportunities to influence them towards life-affirming choices. And she, along with Emily and I, when we see STI patients, we take every opportunity to encourage patients to consider the benefits of a long-term monogamous relationship. And then we have Dr. Gabor Benda, and he is our longtime medical director and has served in this capacity really ever since we became a medical clinic after being a resource center for some years. And that happened around 2006 and 2007. But even before that, I just found out this week that he served on the board of the pregnancy center for around 15 years prior to that. So that's over a quarter of a century of really dedicated, service. So Dr. Benda, reviews and finalizes every single ultrasound that we do at ZoeCare, and he also provides ongoing support to the nurses and gives us direction when we have an unusual circumstance. We are so indebted to Dr. Benda for his many years, and his constancy, graciousness, and wisdom are so greatly appreciated. And I wanted to say that without Dr. Benda and Dr. Hanley in their respective positions, ZoeCare would not be able to function as a medical entity. Please join me again in expressing appreciation that we all feel. Really. So together we form a team, and we are poised to build rapport and form a trusting relationship with each patient. We listen. That's what we do. We listen. We intentionally listen. And regarding the pregnancy patients, we want to listen to her unique story and seek to understand who she is, what she's feeling, and what she's facing. Most of our patients use the adjective scared when they describe how they feel about being pregnant. We seek to reduce her anxiety by providing accurate information about the status of her pregnancy, fetal development, abortion procedures and risks, adoption, and parenting. We also offer mentoring and community resources that address her specific needs as well. So I'm just going to give a quick look into 2 different patient scenarios. A woman that we'll call Marie came to see us because her period was late and she was afraid she was pregnant. Her partner did not come with her. She had been abused as a child and thought that, as a result of that, she could not be a good parent. We lovingly shared the truth about all of Marie's options. Since she was not far enough along for an ultrasound on the date of her visit with us, Marie made a follow-up appointment, but she didn't show up for that. 2 weeks later, Marie scheduled another ultrasound appointment online. And when we saw it, we were so happy to think that she would return for a confirmation ultrasound of her pregnancy. Well, Marie arrived alone, and it became clear that she had already obtained an abortion, but she was so wounded that she did not want to go back to the location to follow up. She didn't even really want to say the word abortion in her visit with us. Her boyfriend, who did not like the effect that the abortion had on her in terms of making her sad and angry, just stopped communicating with her. She was devastated and she was alone. Her boyfriend was the only other person who knew about her pregnancy besides us. Sorry. So at the visit, the advocate was able to sit with her in her sorrow. And there were hugs and there were tears and, talking. And she left us that day, but with some resources to start with the healing process and also with the knowledge that there is a loving God that cares about her in her situation. Now, another woman that we'll call Tammy had an she had an appointment scheduled actually at an abortion clinic, but she came to ZoeCare first to maybe find out how far along she was. and this would not be her first abortion. She had recently moved to the area, and in the midst of the move, she took a pregnancy test. She came to the appointment alone, and she had all the reasons set in her mind why this was a wrong time for a baby. You know, she felt like the father of the baby was immature. She felt that she needed to go and find a job, and the baby really didn't just fit into their the plans for the future at the moment. But as she talked in the appointment, she began to say something like, well, if I keep the baby, and then it began to occur to her also that possibly her partner might want a parent. She received options education, and she was encouraged that things happen for a reason and not by chance. At her appointment, Tammy viewed her child on an ultrasound and observed her baby's beating heart. She left that day with a picture of her baby, a flyer about the Father's Initiative mentoring program, and specific community resources that might help her find a job and a permanent place to live. Sometime later, when the advocate did a follow-up call to her, Tammy said, "I found a job." And she also said, "Can my partner and I come back and have an ultrasound so he can see the baby?" When they returned, they were planning to carry to term and parent their baby. They were encouraged to get involved in our mentoring programs, and Tammy was excited about connecting with an experienced mom through the Mom-to-Mom program, and because she lives far away from her family and she had been raised by her father. So she was really looking forward to that Mom-to-Mom. We have found by initially building rapport that can then form a trusting relationship, we find ourselves then with opportunities to speak the truth in love. It is vital to compassionately and prayerfully come alongside each patient and equip her to make informed choices, choices that will enable her to live well and value the life that God has given her and her child. And we are so privileged that we get to do this work, and we just feel blessed in it, and we appreciate your support in prayer and helping us do this work. We really appreciate it. Dr. Benda is now going to share some thoughts of his perspective and also some images from our new ultrasound machine, which we are so happy we have.
Okay, well, now that you all know that I'm at least a quarter of a century old and a little bit beyond, I have no problem sharing anything else with you. and really, I am just listening to the ministry that we're part of. It's just clear that it's such a blessing to be part of it, because it's just so apparent, the wonderful opportunities and the work that gets to happen inside those walls of Zoe. So it's a privilege to be here for even more than a quarter of a century. So this evening I was hoping to give you an idea of how the ultrasound portion of our ministry impacts the patients that come to ZoeCare. So I thought we'd start with a question that one of my younger patients posed to me some time ago. He says, "Why did the cookie go to the doctor?" Well, of course, it's because he felt crummy. And so the question is, why do patients come into ZoeCare? And there are many reasons, especially now that we have Wendy Handley, as we heard. They come in for many things that Wendy can address and the clinic can address. And it's been a blessing to have her, because it's really expanded our opportunity to speak into the lives of people in many different circumstances. And yet, it's still true, though, that many people seek care because there's a sense of angst due to a pregnancy that's intended or perhaps unintended. And they come in looking for things that I've kind of broken down into 5 categories that are common scenarios. The first is, a lot of times people want reassurance that everything is okay with that pregnancy. Next, sometimes they want to seek options for how to seek medical care for the pregnancy. A lot of times they just want to see the baby, and that's probably the most fun part of the job, because it's always fun to witness that baby moving around in the womb. The next, sometimes decide to whether they should keep the baby or not, and that becomes challenging. And then finally, sometimes they've already decided on abortion, and they're trying to figure out when to actually seek that abortion. So we're eager to interact with even the first three categories of patients because it's rewarding to help reassure them that everything is okay and to come alongside them in the pregnancy. But we feel that God has uniquely placed ministries like ZoeCare in this world to be able to rescue those in the last two categories from a deep abyss of despair when they start feeling like they are not able to come to grips with having a child in the first place. In these situations, when the world, in quotation marks, is telling them that they cannot or should not have this baby, and this is part of that spiritual battle that Chris was alluding to, we are in a unique position to let God do the talking through the powerful image of the ultrasound, which is our window into the womb. Here are a few verses that illustrate how God's truth shouts powerfully through the ultrasound image. In Psalm 139, verse 13, "For you created my inmost being. You knit me together in my mother's womb." And Psalm 19, 1 through 4, "The heavens declare the glory of God. The skies proclaim the work of his hands. Day after day they pour forth speech. Night after night they reveal knowledge. They have no speech, they use no words, no sound is heard from them. Yet their voice goes out to all the earth, their words to the ends of the world. In the heavens, God has pitched a tent for the sun." So now I would propose you could humor me to allegorically substitute the phrase, "the baby created in the womb," for the heavens and the sky. And it takes on a whole new significance as we gaze at the eternal significance of what we are seeing on the ultrasound screen. I'll come back to that later as we review the images. In our ministry here at ZoeCare, yes, we are focused on trying to save the babies' lives, but as we reflect on the work that our dedicated team is performing, as has been illustrated already, we realize that we are just as importantly trying to save the lives of the mothers and the fathers involved in that unplanned and sometimes unwanted pregnancy. In my experience, women and the men that are involved with them that have chosen an abortion will have a lifelong ache deep in their hearts. The post-abortion syndrome is well characterized, and it can include any combination of the following scenarios. First, the recognition of the gravity of that decision that leads them to a relationship with Jesus Christ and the forgiveness that goes with that. These women and men will be a wonderful resource to others that are often utilized in a mighty fashion by God to heal others. Second scenario could be a life of quiet desperation, trying to suppress the memory of the entire extremely difficult experience. The third could be a life of rebellion, leading to a life of activism to work for a woman's right to an abortion. We've seen that over and over again in the nation. Wounded warriors who are just pressing for this right to continue. And finally, all of these scenarios may be associated with guilt, anxiety, depression, substance abuse, eating disorders, and flashbacks. All challenging things to deal with as women heal from a difficult experience. As we go back to the allegory of Psalm 19:1, the ultrasound image has the effect of the baby in the womb declaring the glory of God and proclaiming the work of his hands. And even without speech and sound, their voice goes out into all the earth, and often straight into the hearts of the mothers and the fathers who are wrestling with what the world is telling them and what God is telling them through the baby in the womb. We have seen in our facility what the national statistics tell us, as Chris alluded to, that 8 to 9 out of 10 women and couples will choose life after seeing the ultrasound image of that baby. This choice not only saves the life of the baby, but it will save a world of hurt for the couple, because I have not yet met a single person that has regretted choosing life over abortion. With that as a background, I would like to show some ultrasound images from our newest machine that was generously funded, as you heard, after last year's banquet. And as you look at these images, please look for how these babies are declaring the glory of God, even without speech and sound, as the psalm so eloquently describes. So this first image is a still image of a baby at around 10 weeks of gestation. And you can see a little curled up baby with the head over here. And you can see that umbilical attachment to the placenta, just the lifeline from the mom. It's a cool image. This is the, the view that later, a little bit later in pregnancy, nurses try to obtain to be able to measure the biparietal diameter, and that helps us to assess the age of the baby. But you can see, even at this early stage of 15 weeks, not only do you see the skull, you see structures of the brain. It's very apparent. The falx in the middle of the brain, thalamus sits around here, parts of the cerebellum, all those little brain structures are intact and developing continually. Here is a little profile shot, kind of a cute baby, again, just at 11 weeks of age. Once again, you can see the umbilical attachment. You can see a little hand over here. You can see the lower jaw, the upper jaw, little nose, little eye socket area there. Again, brain structures, little body, the heartbeat sitting in here. We'll get some more pictures of a moving heartbeat later. And then this is another measurement that the nurses strive for to, again, measurements of the baby at this early stage correlate with the baby's age, and so we always seek to date that pregnancy. So they measure the crown to the rump length, so the baby's noggin down to the baby's buttocks there. And then the ultrasound machine does fancy algorithm calculations of how old that baby is based on those measurements. And then this is always a fun shot when we're trying to enjoy God's creation in the womb. We got the hand and the baby sucking its thumb. This is just a still image, a snapshot of that. We'll see more of this later. And again, baby just obviously very comfortable in the womb. And then here's a nice video clip of the heartbeat. And it's readily apparent in this picture here. And you can see the little leaflets of the heart valves, the chambers in the dark areas where the blood is moving through. And it's a clear sign of life in the womb. A miracle, no matter how you envision it. And you can see the baby's femur bone, tibia bone, little toes down there. Again, parts of the brain structure, the ventricles here, all kinds of detail that, frankly, the new machine is quite a bit more vivid than the old one we had, and it's just an amazing, amazing picture to be able to behold. And then this is just another technical picture of how the nurses measure the heartbeat, the actual heart rate. They're able to focus the ultrasound into the area of the heart, and then you actually, on this particular view, get an audible heartbeat that moms and dads love to hear because it's another filling of the senses. And then here's a cool little picture, so you'll have to kind of focus in. This is like a Fonz thumbs up picture. If you watch, the baby's kind of got the hand close to his mouth. You can see the fingers there. And at the end of the video clip, and it's just a brief, it would be better if I could freeze it, but I can't. But the thumb just kind of goes up like this. It's just, you know, these babies already have little personalities in the womb, and it's just fun to be able to witness it. And then this is just an active baby that's doing it. It's multitasking. It's jumping around, throwing its thumb in its mouth, you can kind of see. And once again, you can see the lower jawbone, the maxillary, or the upper jawbone, and that thumb going in between the two of them, just kind of thrusting it right in there, just loads of fun. And then this baby is just like stretching it out, you know, yoga style. You can just kind of see, just sort of arching its back, and just, you know, you can just tell it's having fun in there. And of course, you can see the heartbeat in here as well periodically, and moving all the limbs and all that. And then this one, it's a little dark, but you'll have to look closely. But if you watch, you can just see that baby's, you know, hand and thumb in its mouth, and you can actually see it kind of going to town on sucking that thumb. I mean, it's it's really doing it. And it's not just, an accident that that thumb is in there. The baby's getting some pacification right in the womb from its own little hand. You can kind of see that going back and forth. And since we just can't get enough of the thumb sucking, here's one more. So once again, you can see, a little outline of the fingers and the thumb. And you can kind of see the baby's even kind of shaking its head, kind of really getting into it here. Once again, the heartbeat there. Just a moment of pacification. And then lastly, and I don't know if it's because I spent too much time preparing for this talk, but you tell me, I looked at this image and I thought, oh, this is the one where you can just envision that this baby is shouting the glory of God here towards the end of this video clip. So it's kind of, curled up here, and then it sort of arches, and then if you watch, its mouth kind of opens, and it's just shouting God's glory in the womb. And this is the illustration that we get the privilege of, on a regular basis to see the joy in parents' eyes, and not infrequently, in fact, more frequently than not, as God speaks to them through these images, it really lights up their minds with truth of what this baby in the womb actually represents for them. Thank you for your attention, and thank you for your willingness to take an evening to share this experience with us, and for your longstanding support of ZoeCare.
Thanks, Dr. Benda.